Arthrofibrosis, manipulation under anesthesia. This video gives information about manipulation under anesthesia for arthrofibrosis following knee replacement. When physical therapy fails, the next step is manipulation under anesthesia. Manipulation is considered when the range of motion does not progressively improve, reaches plateau, or deteriorates after knee replacement. It is useful for flexion contracture as well as decreased range of flexion. The timing of manipulation is debated. Most physicians feel that the manipulation is effective when it is done between 6 and 12 weeks after knee replacement. Manipulation before 3 weeks has a higher risk of rupture of the surgical wound and opening up of the knee joint. But if the manipulation is done exclusively to improve flexion contracture, it may be performed before 3 weeks. After 12 weeks, the benefit of manipulation progressively declines and the complication rate is higher. In manipulation under anesthesia, the knee is forcefully bent and straightened using manual force to break the scar tissue and improve motion. It is usually done under general anesthesia and muscle relaxation. Injection of steroid into the knee joint at the time of manipulation has a synergistic effect. For patients with inability to fully straighten the knee, repeated manipulation and application of a cast with the knee in maximum extension is also helpful.